Good afternoon. Our next story today, we get some insight on mammography technology. We have our guest today, Dr. Jana Cleofe. She's a radiologist from BC Cancer Breast Screening to talk about mammography and breast cancer. Hello, Dr. Cleofe.
Hello.
So, Dr. Cleofe, tell us a little bit more about breast cancer.
Breast cancer happens when cells in your breast grow abnormally and out of control, and the cancer cells can spread to other parts of your body. You're more likely to get breast cancer as you get older, but men can also get breast cancer. However, it is rare. A number of screening methods, such as mammograms, can help find and diagnose breast cancer, and factors such as age, family history, or a previous breast cancer diagnosis may increase your risk of developing breast cancer.
Exactly, what is mammogram?
Simply put, a mammogram is an X-ray picture of the breast.
Now, something I've always wondered is, how exactly are mammogram done?
Well, a mammogram is an X-ray of the breast that is used to screen for breast cancer. Mammograms can find tumors that are too small for you or your doctor to feel. When you have a mammogram, a skilled technologist positions and compresses your breast between two clear plates. The plates are attached to a highly specialized camera which takes two pictures of the breast from two directions. Then, the technologist repeats the technique on the opposite breast. For some women, more than two pictures may be needed to include as much tissue as possible. Now, there are two main types of mammography: film screen mammography and digital mammography, also called full field digital mammography or FFDM. The technique for performing them is the same. If you've had a film screen mammogram, the images will be in black and white on large sheets of film. With digital mammography, the images are recorded directly into a computer. The image can then be viewed on a computer screen, and specific areas can be enlarged or highlighted.
Now I understand you have a video that can show us how this is done. So let's roll the clip.
Here we see the mammography unit with its X-ray emitter and two compression plates, and the breast being flattened between the two plates in order to spread out tissue and prevent overlapping. Here is an image of the breast tissue scan. Tumors are different in density than the surrounding tissue. Breast tissue loses its density over time. In younger women, breast tissue may appear to be white or light gray.
That was an informative video. Thank you. Now, I've heard that there's screening mammogram and diagnostic mammogram. What's the difference between these two?
Screening mammograms are for women with no symptoms of breast cancer or no apparent breast problems. Diagnostic mammograms are ordered by a doctor to look at an area of concern in the breast, which may lead to more tests such as an ultrasound or a biopsy.
Dr. Cleofe, tell us the importance of mammography.
Well, now that breast cancer is the most common type of cancer in women in British Columbia, and sometimes occurring in men as well, mammographic examination is really important and useful in helping detect these problems.
Is this procedure painful at all?
Mammography can be painful for some women, but for most, it is mildly uncomfortable, and the sensation lasts for just a few seconds. Compressing the breast is necessary to flatten and reduce the thickness of the breast. The X-ray beam should penetrate as few layers of overlapping tissues as possible.
How long does it take for a mammographic examination?
From start to finish, the entire procedure takes about 20 minutes. A diagnostic mammogram generally takes more time than a screening mammogram because it takes more pictures from more angles.
What about the harmful effects of radiation, Dr. Cleofe?
Mammography involves minimal radiation exposure. In fact, the amount of radiation exposure from modern-day mammography machines is much lower than it was in the past decades.
That's great to hear. How often should a mammography be done?
Well, this decision should be based on your situation, your individual risk, and what you prefer. For women ages 40 to 49, the benefits of regular mammograms are not clear. For women ages 50 to 70, regular mammograms, such as every 2 to 3 years, are recommended by the Canadian Task Force on Preventative Healthcare, or the CTFPHC. Women aged 75 and older may want to talk to their doctors about whether they need breast cancer screening, and your doctor may recommend testing at a younger age if you have risk factors for breast cancer.
Thank you so much for joining us today,
Yep, for
Dr.
sure.
Cleofe. Enjoy the rest of your day.
Thank you for having me. Have a great day.